Hi my beauties, welcome back to Younger. Today I'm going to be talking about periorbital rejuvenation. So the reason why I want to talk about periorbital rejuvenation is because it's probably the most common concern that I get when patients come in to see me is around the eye. Under eye bags, wrinkles, crow's feet, droopy lids. I feel that the periorbital area is a very sensitive area in dermatology and one of the first to show your age and one of the first to give you problems down the line. And it's one of the easiest things that you can prevent by just taking good care of your skin, wearing eye creams and doing little preventative procedures. And then once wrinkles have already started, to do things to reverse that aging process and just make the periorbital area look better. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who you may find it useful. So I kind of wanted to start off just with a little bit of eye anatomy and especially the under eye area, because all my patients of different ages all have some type of under eye ailment, whether it's tear trough areas where they're kind of like sunken or hollow, or people tell them that they look tired even when they're younger. If they had a fun night the night before, when they come into work, people will say they look extra tired. So there's certain things that you can do to kind of make you look more bright-eyed and bushy-tailed even when you're not. Other areas include the lateral aspect of the periorbital area, and that's the first sign to show crow's feet when you get older, sometimes even in your 20s and 30s, and then definitely in your 40s and 50s. And so doing little things like Botox and other things that we can do along the way can kind of prevent that from happening. Then you talk about the superior orbital area, which is the upper eyelid area. Sometimes people get heavy in the upper eyelid area as they get older, and there are minimally invasive things that you can do and actually invasive things that you can do to kind of open the eyes up and give a more youthful look. So the goal is to never look like a different version of yourself, but just a better version of yourself. And there's different things that we can do in that periorbital area to look our best at every age. And starting at a young age is really important, but even if you're getting to your skincare game on point later in life, there's things that we can do to reverse the aging process. And I have a lot of plastic surgeon friends of mine and colleagues, and they all say, and we're all kind of in agreement, that the first area to show your age is this area. If you keep this area looking good, this is the first thing that people see when they look at you, and it can keep you looking your best. So that's kind of the area that you want to invest in. And like I said, as a dermatologist, that's usually the most common complaint that I get when I'm meeting a patient for the first time. So let's start about like younger patients, like in their 20s and early 30s. So a lot of people get these under eye tear trough hollows, which can make you look like you have dark circles under your eyes, but it's really not a discoloration of the eye. It's more of volume loss, or even an anatomical volume loss that we have just when we're born. I look at my 5-year-old daughter Riley, and she has little tear troughs there. Now I'm not going to shoot her up with filler or do anything to treat that. I just happen to know that that's the way her anatomy of her face is. And there's certain things that you can do once you get older, like 20s, 30s, 40s, to kind of minimize that hollow look that can make you look aged or tired, or like you didn't have a good night's sleep, or that you're sick, or that you're unhealthy. You never want to look like that. So doing things like just putting a little bit of tear trough filler in this area. Now, I'm a dermatologist and a derm surgeon, and I spend a lot of time with ophthalmologists, oculoplastics, and plastic surgeons during my residency at UCLA. I rotated with them, and I kind of am a hybrid of all these different specialties because I do tear trough filler, but the way that I do it and the way that you should trust your physician who's injecting you to do it is to use a cannula. When we put tear trough filler in this area right here, we usually numb up an area that's a little bit off-site. If you follow me on Instagram, you can look at my highlights in the tear trough highlight and see how we do this. You numb up a little area right here, and you take what's called a pilot needle, and you make a tiny little poke in the skin there. You can't feel it because you're numb, and the product has numbing in it as well. And a cannula is a longer injectable device that we use to kind of distribute the filler right in this area. It's not painful. Any of my patients who have had this done by me, you can vouch for it. It's not painful. It feels kind of weird because you get kind of numb and you feel me doing something, but it's not painful or it's not uncomfortable. And so when you just add a little bit of volume into that area, I usually use a hyaluronic acid-based filler, so you can reverse it if you don't like it, but I don't think I've ever had to reverse, knock on wood, my tear trough filler because everybody loves it. But once you you put a little bit of filler in there, a little goes a long way, and less is more. The tiniest amount can just open the eyes up, and basically what it does is it blends the lid-cheek junction. When you have a smooth transition from the eyelid to the cheek where it's like one continuous, just kind of plane, it just looks more youthful and it looks healthier and it looks more vibrant. When you have a eyelid and then like a sunken area and then your cheek, and they're not like contiguous, it just makes us look older or more tired. So a tiny little bit of filler is all you need in that area. Now that's different than under eye dark circles that are from actual pigmentation under the eye. So sometimes people, based on their ethnic background or their skin type or skin color, will have darkening under the eyes that can make them look like they have these like dark shiners under their eyes. So basically what you can do, depending on the reason why it is dark under the eye, if it's pigment, we can use different brightening agents and a lot of different eye creams that have like niacin in them, or kojic acid or coffee berry. Different antioxidants that can brighten up that area will help give that under eye area a more vibrant color by taking just the dark hue out of the eyes. Now, sometimes the under eye area is dark because of the vasculature there. So this is why it's important when you see your dermatologist or your plastic surgeon, you have an assessment, because I also often get a lot of questions and DMs from people saying, hey, how do I treat my under eye circles or my dark circles? Well, it depends on what's causing that dark circle. If it's the vasculature, we're gonna have to do a VBeam laser. If it's pigmentation, we're gonna have to use a skin brightener or even a hydroquinone or a non-hydroquinone eye cream to brighten that up. So talking about the VBeam, which I just mentioned before, VBeam, V stands for vascular, and the VBeam laser is a vascular laser. So the underlying vasculature under the eye is almost like a greenish, bluish, purplish discoloration. So when we just do a little VBeam under the eye, usually it takes anywhere from 1 to 3 treatments spaced 1 month apart. It usually fades about anywhere from 30 to 60% per treatment. It gets lighter and brighter with each treatment. And then you don't need to hide it with concealer. Then you could just go without concealer and you don't have to hide these dark circles under the eyes because you've had the laser to correct them. That's why I'm always big on investing in your skin health and your skin biology and having treatment so you don't have to spend money and time covering things up with makeup. And it's a lot more fun to just run makeup free without makeup on your face, and instead just treating the ailment instead of covering it up. So moving on to the under eye area that is not a discolored phenomenon, but more of a texture irregularity. So a lot of people will start to get early signs of aging, 20s, 30s, 40s, and definitely 50s, where you get this crepey skin underneath the eye. Now, crepey skin is a result of a loss of collagen and elastin. So things that are going to stimulate collagen and elastin synthesis in our skin is going to tighten that skin up. So say you have your under eye discoloration is better because you've had a VBeam or you've bleached it out or you've used lighteners or brighteners and you filled in your tear trough so there's no volume depression here and it's a nice smooth contour, but you have this crepey skin. Now what do? So you can use lasers like Fraxel. I love Fraxel Repair, Fraxel Restore, Halo, even Clear and Brilliant if you want to have a couple more treatments because it's a little bit of a weaker laser, but just to kind of keep that area awake and stimulating collagen synthesis to keep that eye skin tight. Also, energy-based devices, Ultherapy, Thermage, Thermatite, different energy-based devices that are going to stimulate the fibroblasts in the skin to make collagen is going to tighten and smooth that up. Now, somebody who's starting like in their early 20s and 30s, I remember when I was in residency, I would sneak out of my lecture and go and just be fraxeling under my eyes. I started at an early age in my 20s and I still continue to do that for maintenance. But say people didn't have access to this before, or they're just now kind of starting to notice the crepey, wrinkly skin starting under their eyes. The sooner you started, the better, but if you don't start until they're already formed, it's okay. You can still reverse it, but it just takes a little bit more treatments, a little bit more time, and you may need 5 to 6 treatments spaced 1 month apart, or over the next course of a year, you're going to probably just up your game and maybe get 2 or 3 treatments a year. They're all additive, and so what these lasers do and energy-based devices do is it just kind of stimulates your skin cells to respond by making collagen. I'll have another episode on where I just talk about energy-based devices, but anytime you stimulate the skin, you wake it up. It's like going to the gym and working your muscles. When you go to the gym and you lift heavy weights, you stimulate your muscles, and in response, they get hypertrophic or bigger. And so when you stimulate their skin cells with an energy-based device or a laser, it's going to stimulate your skin cells to wake up and make collagen and elastin and replace what you have lost over time. Because as the decades go on and as we get older, we lose about 10% of our collagen per decade, and your skin cells start to become senescent. They start to get sleepy and they go to sleep and they start being lazy and they stop making collagen collagen and elastin, but they get hit by a laser wavelength and they wake up and they get stimulated to act and behave younger, which means they're going to be more active and making more collagen and elastin, which is going to result in smoother texture and tighter skin under the eyes. So if you just let nature passively take its course on your skin, then you're going to age. But if you can do things to kind of exercise your skin and stimulate it to behave more actively and younger, then you're going to look younger and you're going to look better. So moving on to the lateral aspect of the eyes, this is the crow's feet area. So a little bit of Botox goes a long way. Usually when we do Botox, we do 3 injections here, here, here. Even if you have a smaller dose of Botox, you never want to give a little small dose of Botox with 1 injection. You always want to do 3 injections. I remember when I was in fellowship, a paper was published on the use of a single injection site. Depending on the number of units used, it's just you get a more evenly dispersed around the orbicularis oculi, which is the muscle around the eye that basically will give a very even, very natural inhibition of that muscle from contracting really tightly to where you're going to get these lines. You're still able to animate, you're still able to make faces and be very animated when you speak or when you smile, but it will prevent them from according that skin and making it tightly wrinkled in that area. So I have a lot of my younger patients who come in for Botox. They need a way smaller dose, spaced way far apart, versus my older patients who are pretty animated or have some sun damage and are kind of late to the game. That's okay. We can smooth that out too. It's just you may need a little bit more Botox. I usually never do more than 10 units per side. And on my younger patients, I do anywhere from, maybe 4 to 8 units per side. And that's even on like the heavier dosing. So that's kind of how we fix the crow's feet area. Now looking at the upper eyelid, there's a phenomenon called dermatochalasis, and that's when your eyelids are really, really heavy. Now as a derm surgeon, I perform blepharoplasty, which is an upper eyelid surgery where we actually remove a piece of the skin. It's actually very easy to do, and it's easy on the patient as well. You just come into our office. It takes 30 minutes. We put some numbing eye drops in your eye. We use some local anesthetic. It's super fun. The patients are awake and talking to me. They have their eyes closed and they're really relaxed, but it's not a big deal. But that is surgery. That's cold steel is what we call it in medicine, and that's something that's on this side of the spectrum when you're going a more aggressive approach. But going on the opposite, the polar end of this spectrum, starting with the minimally invasive techniques, you can do things like Fraxel, where we do a resurfacing to stimulate collagen and tightening up that skin. A Fraxel can do a lot with respect to stimulating collagen and tightening that looser eye skin for people who aren't at the point where they need surgery. Usually patients like in their 40s, when they start to notice a little of that dermatochalasis or like the heaviness of their upper eyelids and they want to do something, Fraxel is a good option for them. You can also do Thermage, which is an energy-based device, or Ultherapy, which is another energy-based device. Thermage uses radio frequency. Ultherapy uses ultrasound. I know I'm throwing a lot of like science lingo and terminology at you, but I know my followers are smart and you guys understand what I'm talking about. You guys are well read, and if not, I'd be happy to answer your questions or comments on anything that I'm discussing right now. But those 2 energy-based devices, again, stimulate collagen, stimulate elastin, tighten the skin, open the eyes, get rid of the wrinkles, or at least reduce the wrinkles and make the eye periorbital area look better. So the other thing that you can do in the upper eyelid area is like a thread lift. So if you guys heard of like the Mint threads and Nova threads, these are basically string-like filler that have a mechanical pulling effect. So sometimes we do almost like a brow lift where we inject these threads in the upper brow and it basically opens up the eyes, which kind of lifts the upper eyelid skin off the eye and makes your eyes look more awake, alert, and oriented, and brighter and refreshed. And so that's kind of in the middle of the spectrum before going to surgery. So a lot of times when we're looking at somebody and we're looking at their, say they have hooded eyelids or like the droopy, the heavy upper eyelids, what we do is we look and see where the brow is laying. So when you palpate the eyebrow, you want it to be resting on the superior orbital rim. The superior orbital rim is the part of your skull. You can actually feel it when you're going along your brow bone. And if your eyebrows are below that, then you are a candidate for more a brow lift. If your eyebrow is right along the superior orbital rim, that bony part of the skull, you can feel your eye orbit, like where your eye socket is. If it's above that area, usually you're a candidate for an upper eyelid surgery or what we call a blepharoplasty. And so sometimes, people, if they have a brow lift, they won't need the blepharoplasty. Sometimes people who have the blepharoplasty, they wouldn't have benefited out of the eyebrow lift. So there's different ways you can open the eyes, and it all depends on placement and a very thorough assessment by your provider, your surgeon, your plastic surgeon, your dermatologist, whoever's treating you. So you have to make sure that they do a correct assessment, because you would never want to have the wrong procedure by the wrong doctor. Not to scare you, but sometimes you'll see a surgeon and they'll want to do a brow lift and you're more of a candidate for a blepharoplasty. So my job is just to kind of inform you guys as patients and consumers for what to kind of assess yourself and kind of have that background information. So when you go in for a clinical consultation, you kind of have that background information. And when they suggest brow lift versus blepharoplasty, energy-based device, Fraxel, you're kind of armed with knowledge, because knowledge is power. And so you can decide what is best for you. And then if your provider discusses different options, you can challenge him or her and kind of come to an agreement on what would be best for you. So that's pretty much it. The last thing I wanted to say with the heavy eyelids is this. So sometimes when people go get Botox by somebody who's maybe not very experienced, maybe they didn't resuspend their Botox correctly, maybe they didn't inject it at the right points. Everybody in the world right now is doing Botox. So you have to make sure you're going to someone who's reputable and has experience, and look at their before and afters, read the reviews, because basically when you do Botox too far down on the forehead, you have to remember Botox diffuses about 1.5 centimeters. And when people get their forehead lines treated, you want to adjust for that. So if people are getting Botox up here, it's going to diffuse about right here. If they're doing Botox too low and it drops down and it makes the eyelids too heavy, that's not a good look for everyone. I mean, it's temporary. It only lasts about 3 months, but who wants to walk around like that for 3 months? So that's the other thing that I wanted to mention. When you have Botox and you get too heavy on your eyelids, that's the reason why. And so if somebody's coming at you with a needle way too low, question him or her and say, hey, don't you want to go a little bit higher? So knowledge is power. I love empowering you guys, and I love that you're thirsty for this information, and I'm happy to share. Thanks.